Good afternoon. My name is Suzanne Stephen. Now, I had came on earlier and was talking about CTE. Yes, I was talking about CTE, football, and a lot of people say that it doesn't equate to mental illness. Of course, it does. I wrote some stuff down. Yes, there is a significant and growing body of evidence showing chronic traumatic CTE contributes to mental illness. There is also some indication that the predisposition to mental illness can interact with CTE and worsen certain symptoms. Okay, so it does. All right, I got my hair in ponytail because I'm working on this. We're going to find out the spiritual implications down the line. Okay, one. Let me see. There is a breakdown of the relationship, how CTE contributes to mental illness. All right, direct brain damage, degression of brain disease caused by repeated head impacts. These impacts even if they don't result in a concussion, can lead to buildup of abdominal tau protein in the brain. Okay, this protein disturbs brain function and causes brain tissue to shrink. So we're dealing with a shrinking brain because anything that experiences atrophy, the brain has experienced atrophy, right? So now it's shrinking, just like muscles. All right. So the brain is a muscle too. So think about that. All right. Common mental health symptoms. The symptoms of CTE often include range of medical health and behavioral symptoms. These can appear in the early 20s, wow, and 30s, of much clearer or much later, and often include mood swings, depression, anxiety, emotional instability, okay, behavioral changes, impulsive behavior, aggression, irritability, and poor judgment. Cognitive difficulties, memory loss, especially short term, confusion, difficulty concentration, impairing executive function, planning and organizing. Other serious symptoms, suicidal thoughts of be- thoughts of behavior, paranoia, substance, and misuse. Okay, progression of symptoms. These mental health symptoms can worsen as CET progresses through the stages. In later stages, provides individuals may develop dementia. Okay, dementia like symptoms. Does mental illness increase the risk of CTE? This is less clear, but mental illness itself is known to cause CTE. This also happens in women and anything that's shaken, okay, but in more severe cases, football. What I write now? Linked. Okay. However, there's emerging research suggestion and interaction. Aggression in family history, of course. Recent studies indicate that individuals with CET can also have a first degree family history of mental illness, maybe at higher risk of aggression in midlife. This suggests that a genetic disposition to mental illness might make certain CTE symptoms, like aggression, more pronounced. It is not that mental illness causes CTE, but rather a pre-existent vulnerability might influence how CTE manifests. Okay, I am a behavioral therapist, psychologist, and guidance counselor, and of course, mentalist, clairvoyant, tarot card reader, singer songwriter, and whatever and whatever. But this is really interesting. Okay. Um, Key points to remember. Currently, CTE can only be, well, you know how, I'm not going to say, I'm not on TikTok, I'm trying to keep it. Receptive head impacts. Okay. The leading risk factor for CTE is history of repeated head impacts common to outdoor sports like football and boxing in military service due to explosive blasts. Military, I don't know, due to explosive blasts in military. Not everyone develops CTE. Um, will develop it. And mechanisms, individuals' vulnerabilities are still being researched, right? I'm gonna research, right? As soon as I get off this research, I'm gonna the implications of spirituality to align. Now that body has to be totally aligned, back to alignment again. It's just like, okay, let's say you broke your back, right? And now your vertebrae are small because they're no longer working, right? With this, you had the ability. It Everything could be fixed. We get a new skeletal system every 7 years. Let me see. I still got time. Okay. All right. All right. Okay. All right. Yes. Let me finish reading. In conclusion, there's strong evidence that CTE can directly lead to a variety of mental health issues due to brain damage. While mental illness doesn't cause CTE, a family history of mental illness may exacerbate certain behavioral symptoms, such as aggression in individuals with CTE. Research in this area is ongoing to better understand these complex relationships and develop effective. We're gonna, now I'm gonna come back on, not today though, how to cure it. You know what I'm going to tell you. The body needs to be aligned. Everything is possible. Everything is possible. And that's, we could CTE in third eye therapy. Okay, guys, I'll see you later. Just wanted to come on and tell you I'm working on it. I'm working on it.